Vice-Chancellor, by authority of Senate, I present to you this person on whom the Senate desires you to confer the honorary degree of Doctor of Science, Tedros Adhanom Ghebreyesus. Vice-Chancellor, today we come together to honour a man whose tireless dedication and passion for improving the health of all has challenged us to raise our own ambitions for the well-being of every citizen on this planet. In Dr. Tedros, we celebrate an innovator of global distinction in the area of public health, a visionary Director General of the World Health Organization who has shown himself to be an inspirational leader of historic significance. Born in the city of Asmara, then Ethiopia, now Eritrea, Dr. Tedros graduated from the University of Asmara with a Bachelor of Biology before earning a Master of Science in Immunology of Infectious Diseases from the University of London, a Doctorate of Philosophy and Community Health from the University of Nottingham, and an honorary fellowship from the London School of Hygiene and Tropical Medicine. Thereafter, Dr. Tedros returned to Ethiopia to support the delivery of health services, first working as a field-level malariologist before heading a regional health service, later serving as Ethiopia's federal government for over a decade as Minister of Health and Minister of Foreign Affairs. In these roles, he elevated the status of health on the political agenda nationally, regionally, and globally. Under his leadership, Ethiopia expanded its health infrastructure, developed innovative health financing mechanisms, and expanded its health workforce, but always with an eye to equity and detail. A major component of the reforms he drove was the creation of a primary health care extension program that deployed 40,000 female health workers and delivered an approximate 60% reduction in child and maternal mortality. Truly remarkable. Dr. Tedros was elected WHO Director General by WHO member states in 2017. Notably, he was the first person from the African region to head the WHO. Prior to this, he held many leadership positions in global health, including as chair of the Global Fund to fight AIDS, tuberculosis, and malaria, chair of the Rollback Malaria Partnership, and co-chair of the Partnership for Maternal, Newborn, and Child Health Board. Dr. Tedros is a celebrated global figure. He was the first non-American to receive the Jimmy and Rosalind Carter Humanitarian Award in 2011, recognizing his contributions to public health. He was one of Time magazine's 100 most influential people of 2020, and he won the African of the Year Award for 2020 from the African Leadership magazine. We are excited that this latest honour from the University of Glasgow will take its place proudly alongside such remarkable recognition. Upon taking his role at the WHO, Dr. Tedros stated, "Our vision is not health for some. It's not health for most. It is health for all, rich and poor, abled and disabled, old and young, urban and rural, citizen and refugee, everyone, everywhere." This desire to achieve true equity of opportunity, regardless of circumstances of birth, the right of all mankind to a healthy body, mind, and spirit, is surely reflected in the University of Glasgow's own ethos. Our founding ordinances, the Papal Bull of 1451, said, "Let there be a flowing fountain of the sciences so that all may drink," and that the university should show man the way to live well and happily and raise to distinction those that were born in the lowest place. There is an old African proverb: if you want to go fast, go alone. If you want to go far, go together. We find inspiration from Dr. Tedros' prioritization of partnership as an ethos, recognizing that health for all requires partnership at all levels and between all areas of society. Dr. Tedros has worked to engage stakeholders from a broad range of sectors, from civic society and government to the private sector and beyond. The University of Glasgow has taken inspiration from this very ethos, this collaborative partnership approach. Consider, for example, the Blantyre project in Malawi. This symbiotic partnership between Kamuzu University of Health Sciences and University of Glasgow has produced a joint healthcare program to compare the causes of poor health and low life expectancy in Blantyre, Malawi, to those in the west of Scotland, symbolised by Blantyre, Scotland. We hope that Dr. Tedros will see his own philosophy in what we are doing in Malawi and more recently in Zambia. Indeed, on behalf of our African partners, we extend a warm invitation to Dr. Tedros to visit these facilities at any time to see the power of health research in action in real time therein. In Africa and beyond, the University of Glasgow understands the interconnectedness of our planet's health ecosystems and the role that planetary health plays in humanity at the most basic level. Our people cannot live longer, healthier lives against the spectres of food insecurity, biodiversity loss, and climate change. Our researchers and educators know that these scientific challenges have very real-world impacts for the inhabitants of our shared planet. And we also know that these challenges and the injustice of health inequality are disproportionately experienced by those in the poorest parts of the world. Therefore, University of Glasgow, drawing inspiration from the guiding forces embodied in WHO, is prioritising and coalescing much of our collective effort around these themes. As society rises to these challenges, I'm sure that Dr. Tedros, like me, remains a staunch advocate for the role that universities must play in tackling them. And if I might finally return for a moment to the university's founding papal bull, which stated that the university was not only for the advantage and profit of the city, but also of the indwellers and inhabitants of the whole Kingdom of Scotland and the regions lying around. Today, our university sees no geographical limit to those regions lying around, as we embrace world-changing Glasgow as a central tenet to our vision of what we strive to be. Our global university, our global Glasgow University community, our established researchers, educators, and especially our students will become the clinicians, the scientists, and the health researchers of tomorrow, should take great inspiration from Dr. Tedros, this remarkable man who is surely the most exemplary of world changers. Vice-Chancellor, I invite you to confer the honorary degree of Doctor of Science on Tedros Adhanom Ghebreyesus.
Good evening, everyone. Thank you very much for your patience as we have turned around the set in front of you, I get to add my very warm welcome to this evening's celebration. I'm Dame Catherine Granger. I'm the Chancellor of this wonderful university. It is my absolute joy and privilege to be in this role. Every day as the Chancellor of the University of Glasgow is a special day, but inevitably some days are a little bit more special than others. And I hope you'll agree today is a very special day. We are in wonderful company, and I want to add my congratulations to Dr. Tedros for now being officially University of Glasgow graduate. You are part of the university community. You will always now be part of the family, and we're very proud to have you here. Now, that would be enough normally for a Tuesday evening, but we're going to spoil you. We can also welcome Gordon Brown, who's joined us as well. Gordon Brown is obviously a former Prime Minister of the United Kingdom. He is also a World Health Organization ambassador for global health financing, and importantly, also a University of Glasgow honorary graduate. So it's like a family reunion today, and shortly I'll be asking all three of us to the stage, and I'll be trying to make sure we don't squabble like family reunions often end up. I'm going to, first of all, before we join the full panel, invite Dr. Tedros to come and deliver his keynote speech.
The Right Honorable Gordon Brown, my friend, fellow honorary graduate and former Prime Minister, in that order of importance, Chancellor Dame Catherine Granger, Principal and Vice Chancellor Professor Sir Anton Muscatelli, dear students, faculty, colleagues, and friends. Good evening. It's wonderful to be in Glasgow. I'm deeply honored and humbled, but also very proud. Very proud to be awarded an honorary degree by the University of Glasgow, a university with such a rich heritage, including in science and medicine. As many of you know, it was here at the University of Glasgow in 1837 that James McKeon Smith became the first African American to receive a university medical degree, having been denied admission to universities in the United States because of his race. Then there is Marian Gilchrist, who became the first woman in Scotland to graduate in medicine in 1894. John McIntyre, who opened the world's first X-ray department in 1896, and Ian Donald, who gave the world its first ultrasound image of a fetus in 1958. I was also very impressed to read that the university has produced no fewer than 3 prime ministers, 3 first ministers, and 7 Nobel laureates, including John Boyd Orr, the first scientist to demonstrate a link between poverty, poor diets, and ill health, who was awarded the Nobel Peace Prize in 1949. And Professor Robert Edwards, who co-established the world's first IVF clinic in 1980 and was awarded the Nobel Prize in Medicine in 2010. I was also astonished to discover that Albert Einstein was awarded an honorary degree and delivered his first lecture on relativity here at the University of Glasgow. So, Gordon, my friend, we're in good company. There is another alumnus of this university who is less well known, but is very dear to our hearts at WHO. Dima Al-Hajj from Gaza. Dima was a master student here in Glasgow in 2018 and 19 as part of the Erasmus exchange program. She returned to Gaza where she joined WHO, working as a patient administrator at the Limb Reconstruction Center. Dima was killed in November alongside her husband, their 6-month-old son, her 2 brothers and dozens of other members of her family and community, when the house in which they were seeking shelter was bombed. She was 29. This afternoon, I met Roseanne Maguire, a research associate in mental health and well-being here at the university, whose family hosted Dima Al-Hajj for 2 months in 2018. Dima's death is a huge loss for Roseanne, as it is for her WHO family, and it gives us even more reason to work every day to alleviate the suffering of the people of Gaza in any way we can. Dima was the person she was in part because of her time here at the University of Glasgow, which shaped her life as it has shaped the lives of so many people for more than 570 years. I'm pleased to see that the university continues to build on its rich heritage with leading research in precision medicine and chronic diseases, One Health, and addressing inequalities. On the subject of chronic diseases, I would like to take this opportunity to thank the Scottish Government for providing funds for the next 5 years to support the Health for Life Fund, a joint initiative between WHO, UNICEF, and the UN Development Programme to catalyze action on non-communicable diseases and mental health in low and middle-income countries. Non-communicable diseases, or NCDs, including cancer, diabetes, cardiovascular and respiratory diseases, are the world's leading cause of premature mortality. And 86% of premature deaths from NCDs occur in low and middle-income countries, largely because of the inequalities those populations face in accessing the care and medicines that are more easily accessible in high-income countries. Indeed, most global health challenges are not challenges of science or medicine. They are challenges of inequality and inequity, poverty, marginalization, disadvantage, remoteness. Equity has been at the heart of WHO's mission since it was created in 1948. Our Constitution says that health is a fundamental human right of all people without distinction. And equity has been the driving force of my work. One of the first countries I visited outside Ethiopia was Denmark, where I was a student in the late 1980s, and where for the first time in my life, I had health insurance. I couldn't believe that even as a foreigner, I had access to health services free of charge. I had the same experience during my master's in London and my PhD in Nottingham when I was beneficiary of the NHS. Those experiences were very influential in shaping my commitment to universal health coverage. The idea that all people can access the health services they need without financial hardship. Equity is also at the heart of the pandemic agreement that countries are now negotiating at WHO, building on the lessons of the COVID-19 pandemic. The pandemic exposed and exacerbated the vast inequities that are at the root of so many global health challenges. The development of vaccines in record time was a triumph of science. But before a single vaccine had reached an arm, high-income countries had used their financial muscle to pre-order most of the world's supply. Lower-income countries were left behind, waiting for scraps. Of course, this was not a complete surprise. When HIV first erupted, there was a 10-year gap between the richest and the poorest countries getting access to life-saving drugs. When the H1N1 influenza pandemic struck in 2009, vaccines were developed, but by the time poorer countries got access, the pandemic was over. Similar stories can be told for access to medicines for cancer, diabetes, hepatitis C, rare diseases, and more, where the prices set by manufacturers put them out of reach for lower-income countries. Very often, that were developed initially in public health research institutes. Anticipating a similar scenario, WHO joined partners early in the COVID-19 pandemic to establish COVAX to facilitate equitable access to vaccines, and I would like to thank my friend Prime Minister Gordon Brown for being such a strong and vocal advocate for COVAX and for vaccine equity more generally. Together, WHO and our partners distributed almost 2 billion free doses of vaccine to 146 countries. In lower-income countries, COVAX represented 75% of vaccine supply, saving an estimated 2.7 million lives. It helped us to reach the world's poorest and most vulnerable faster than we would have otherwise, but not fast enough. There is no doubt that the delays in reaching lower-income countries and communities with vaccines cost lives. We cannot allow the same thing to happen next time. And there will be a next time. History teaches us that the next pandemic is a matter of when, not if. It may be caused by an influenza virus or a new coronavirus, or it may be caused by a new pathogen we don't even know about yet, which is what we refer to as disease X. There has been a lot of attention on disease X recently, but in fact, it's not a new thing. We first used the term disease X in 2018 as a placeholder for an as yet unknown disease for which we can nonetheless prepare. COVID-19 was a disease X, a new pathogen causing a new disease. But there will be another disease X, or a disease Y, or a disease Z. And as things stand, the world remains unprepared. If a new pandemic began tomorrow, we would face many of the same problems we faced with COVID-19. To be sure, in response to the lessons COVID-19 taught us, WHO, our member states, and our partners have established several initiatives to make the world safer from future pandemics. For example, working with the World Bank, we have established the Pandemic Fund to support countries to strengthen their pandemic preparedness and response capacities. To increase regional production of vaccines, we have established the mRNA Technology Transfer Hub in South Africa and a global training hub for biomanufacturing in the Republic of Korea. To improve the world's ability to detect signals of outbreaks faster, we have set up a new WHO Center for Collaborative Intelligence in Berlin. To strengthen international sharing of biological samples and sequences, we established the WHO BioHub in Switzerland. And we're also working on a new mechanism for more equitable access to medical countermeasures, including vaccines, tests, and treatments. There are several other initiatives, including the Global Health Emergency Corps, the Universal Health and Preparedness Review, which is a peer review mechanism, the International Pathogen Surveillance Network, and the Preparedness and Resilience for Emerging Threats Initiative. But there is one key missing ingredient. One of the biggest deficiencies of the COVID-19 pandemic was the lack of global coordination and cooperation between countries. It was in many ways an every country for itself response. While sovereign governments have the responsibility to protect their people, a global threat demands a coordinated global response in which countries work together to keep themselves and each other safe. Indeed, that's exactly what the countries of the world have done in response to numerous global threats since the end of the Second World War. For example, since the WHO Framework Convention on Tobacco Control came into force nearly 2 decades ago, smoking has decreased by 20% globally. Likewise, the UN Framework Convention on Climate Change and the Paris Agreement have brought countries together to make binding concrete commitments to reach concrete targets to reduce emissions and limit global warming. There are numerous other examples, like the Nuclear Non-Proliferation Treaty, the Geneva Conventions, the UN Charter, and the WHO Constitution itself. All are binding agreements in international law to meet common threats with a common response. So surely it makes sense for countries to agree on a common response to the common threats of pandemics, a risk that's increasing every day with environmental degradation, climate change, and the ever-present risks of zoonotic spillover. It's for that reason that in December 2021, WHO's member states met in Geneva and agreed to develop an international agreement on pandemic preparedness and response, a legally binding pact to work together to keep themselves and each other safe. When they started on this journey, countries set themselves a deadline of completing the agreement in time for adoption at the World Health Assembly in May of this year. That's now just 11 weeks away. However, there are currently 2 major obstacles to meeting that deadline. The first is a group of issues on which countries have not yet reached consensus. They're making progress, but there are still areas of difference that need further negotiation and give and take. None of them are insurmountable. If countries listen to each other's concerns, I'm confident they can find common ground and a common approach. The second major barrier is the torrent of fake news, lies, and conspiracy theories about the pandemic agreement, that it's a power grab by WHO, that it will give WHO power to impose lockdowns or vaccine mandates on countries or stop travel, that it is an attack on freedom. These claims, as you know, are completely false. WHO does not have the power to impose anything on anyone. We don't want it, and we're not trying to get it. The agreement has been written by countries, for countries, and will be implemented in countries in accordance with their own national laws, just like other international agreements. And just like other international agreements, it won't give WHO any power over sovereign states. The Tobacco Convention does not give WHO any power over national tobacco policies, nor the power to stop anybody smoking. The Paris Agreement does not give the UN power over national policies on climate or energy. This agreement is about international cooperation, sharing information, and increasing the equitable distribution of life-saving tools to stop the next pandemic. We can't know when the next pandemic will be, or how mild or severe it might be, but we can be prepared. This morning, I had the opportunity to visit the Glasgow Botanic Gardens with my family. My family is here, my wife, my 2 children, and the friend of my son. During that visit, I read that in 1832, a cholera epidemic killed 3,000 Glaswegians. I don't know if I said it well. This is almost 200 years ago. In Glasgow, 3,000 people died of cholera. Then in a nearby greenhouse, just few steps away, I saw a sign on the wall asking visitors to maintain distance to prevent transmission of COVID-19. So you have cholera 200 years ago, now COVID after 200 years. 2 public health emergencies, almost 200 years apart, and so much has changed in that time. But much hasn't. As Albert Camus said, there have been as many plagues as wars in history. Yet always plagues and wars take people equally by surprise. We must not be taken by surprise next time. And not to be surprised, we have to be prepared. So we know the outcome if we get prepared. As the generation that lived through COVID-19, we have a collective responsibility to protect future generations from the suffering we endured. Because pathogens have no regard for the lines humans draw on maps, nor for the color of our politics, the size of our economies, or the strengths of our military. For everything that makes us different, we are one humanity, the same species, sharing the same DNA and the same planet. We have no future but a common future. Once again, I offer my deep gratitude to you, Dame Catherine, and the University of Glasgow for the great honor you have given me today. I accept it proudly, not only on my behalf, but also on behalf of my family here, on behalf of the incredible people I'm privileged to call my colleagues, all my WHO colleagues and beyond, and people like Dim Al-Haj, who work around the world every day, sometimes in very difficult and dangerous situations, to make it a healthier, safer, and fairer place. I thank you. Thank you.
Wow, thank you so much for those incredible words. I love the idea ending with talking about humanity and the shared future we all have. I don't know where to start. There's so much here. As I said, this is such a privilege sitting on this stage with these 2 heavyweights of global health and global health finance. And that's partly why we've got Gordon here, because I want to just sit and listen to this wisdom that's going to come off these 2 incredible minds. If I'm an expert in anything, I'm an expert in sport. So I'm going to lay out the rules of the game tonight. We're going to listen to a conversation between these 2 for a while, and then I'm going to come to you as an audience, and I hope you're ready with some questions. This is a full audience participation event. So we're going to have 4 people, well-trained, ready to run around the room at high speed in a sort of treasure hunt way. So when we get to that point, just raise your hands if you have a question, and a microphone will arrive at you with a blink of an eye. Are we ready? All right. Gordon, thank you very much. I'm going to hand over to you.
Well, can I first of all say this? Thank you, Catherine, for your contribution through sport to making sure that people realize the contribution that sport and fitness makes to health and well-being. I think that's been very important. I think nobody's done more than you to get that message across. Thank you.
Thank you.
And I think we will look back on this evening at the memorable speech we've received from Dr. Tedros, because I think it's true to say that no one has done more to show us in his work as head of the World Health Organization that global problems need coordinated global solutions. And your speech this evening is really telling us that the real enemy in this world is not another country or another ideology or another creed, but it's poverty, it's famine, it's illness, it's disease, and we've got to spend our time combating that. And so you talked this evening, Dr. Tedros, about the Global Pandemic Accord. And it may seem remarkable to people in this audience that we've had COVID, and before COVID, we never had an international agreement of the kind that Dr. Tedros is talking about, that we would act together if a pandemic hit the world. And it is such an important agreement to show that we are serious about working together and cooperating where there are difficulties. And we've had some great examples in history that you mentioned where people have come together internationally to deal with huge problems. You know, the nuclear test ban treaty in the 1960s, reduction of nuclear weapons in the 1980s, dealing with the ozone layer. Some of these are examples of things that have been done. Now, the question I think people want to know is, what do you want us to do in these next vital 2 months when there are people campaigning against this accord, which seems like common sense? What would you like us all to do to make sure that this accord goes through in May, and so that we are properly prepared for a future pandemic? Tell us what you want this audience to do, and what you want our country to do, and what you want other countries to do to make this accord a reality as soon as possible.
Thank you. Thank you very much, Gordon, and thank you, Dame Catherine. I met public health students this afternoon, and they had many questions for me. Of course, we couldn't proceed to the questions, but I said, okay, I would be happy to answer these questions, but I have just one question for you first. Please answer my question. And they agreed. And my question was exactly what you said. What can we do in the next few weeks to have a deal, the May 2024 deal on pandemic accord? As you said, which, you know, it's not a new thing, it's the first thing. It's not the first thing. We have many agreements in the past. So I asked them, okay, how can we make this happen? And they had excellent recommendations. And one of which is they would like to start a social media campaign to counter the mis and disinformation. Because what's being spread in the social media is completely false. I said it in my speech, and the students understand that WHO is not going to take any country's sovereignty. It will not. And that didn't happen. We had many treaties about other things, like Gordon, you said, the nuclear non-proliferation, for instance. It respects the sovereignty of the countries. The Paris Agreement, the same. And it will not happen with this agreement as well. So the sovereignty issue is actually wrong. But not only that, there is some, lies as well, saying WHO will order lockdowns and, or mask mandates, which is again not true, because countries will decide whatever they want to do in their territory based on the risk they assess, and WHO cannot give orders. And this is silly, actually, to be honest. It will not happen. It cannot happen. By the way, alarmed by this, the countries who are negotiating, they have included a statement or a text saying WHO will not have this whatever, or not only WHO, but they say that WHO and the Director General will not have this power, or will not affect the sovereignty. This agreement will not affect sovereignty. I'm glad that it's clearly put in the document now, because anybody can see that it's not true. So what you have decided, what you have suggested to me in our meeting this afternoon, I think that would be really good. And I like the idea of having Glasgow University for pandemic accord, and really telling the truth to the world, what it means, what this pandemic means, why it's so important. So I think not only Glasgow University, what they have suggested is other universities, they can mobilize other universities to join in this campaign, so the world gets the right information, the right, the facts, and counter the lies that are really spreading everywhere. The sad part is not only social media, even mainstream media. Even in some parliaments, they're raising it. And some members of parliament are also saying the same thing, which is sad. But I hope they will understand and support the idea of having this pandemic accord in order to prepare the world, because we were not prepared, we paid dearly, and we need the pandemic accord to prepare for the future.
So as you said in your eloquent speech, I mean, we are in a world where nationalism is rising, protectionism is rising, xenophobia is rising. We're in a world where the very idea of coexistence is being put under pressure. Israel, Gaza, China, America, Ukraine, Russia. What are the different things that you as a World Health Organization can do to advance this cause of international cooperation? I remember being at an IMF meeting, and there was a load of demonstrations outside, and there was this banner that said, "Worldwide Campaign Against Globalization." And you thought, what are they thinking? What are they thinking? How can we actually, through the work of the World Health Organization and cooperation internationally, show that cooperation makes a difference? I mean, you've got so many examples from what you're doing: infant mortality, maternal mortality, all the cooperation that's been possible to deal with a number of diseases. Can we not get these messages more across to people that cooperation does make a difference?
Yes. I think we have to make sure that people understand the importance of multilateralism. There are many things that are common problems for all countries or humanity, and that can only be addressed if with solidarity. So multilateralism means solidarity. Multilateralism means using our coordinated effort to address common problems. Recently I met some representatives from the US, and we were discussing about Ebola in DRC. The Ebola in DRC was contained, although it took us 2 years. It started in 2018, and by 2020 it was over. Of course, it took a lot of effort to stop it, under the leadership of the government, of course, and with partners. And when it started, we said we should contain it in DRC. It shouldn't cross borders. And we managed to do that. And then the idea when we discussed with these representatives was, when we cooperate, this was, as I said, not only WHO, all the multilateral organizations, but there are many partners involved. When we work together, not only we can help the country which is having an outbreak or a problem, we can also keep the rest of the world safe. So what they basically said is, okay, when we address the issue at the root and manage the Ebola as early as possible, US became safe. So the solidarity actually brings safety for everybody, and multilateralism brings opportunities or safety for all. And not only WHO, by the way, other multilateral organizations as well. If they didn't exist, we would create them again, because there are roles that cannot be done by individual countries, only through a multilateral mechanism. But one thing that's clear is, whether it's UN or the World Health Organization, these are organizations that the member states make them. So as long as there is partnership and willingness and political commitment from countries, then the multilateral organizations can also deliver or deliver what is expected.
So that message, no one is safe anywhere until everyone is safe everywhere, is the sort of message that comes out of the pandemic. So one of the other problems that you're facing, we still have, 300,000 mothers dying in childbirth. We have 5 million children dying before the age of 5. We've got obviously massive problems still with cigarettes, alcohol, sugary drinks, affecting people's fitness. We have malaria, tuberculosis. Where do you think the breakthroughs can come with the work that the WHO is doing? Where do you expect the biggest advances to come in the next few years?
I think the first, we're derailed from the sustainable development goals. I don't think we need to reinvent the wheel. We have to recognize the SDGs are still valid and very important. And since we're already derailed, there is a catch-up that we need to do. Of course, by 2030, it will be very difficult to achieve all the SDG targets. So the first thing is to recognize that SDG is still valid. But of course, since we're late, we have to understand the current progress, where progress is and where there is a lag, and then try to find ways to catch up for the lost time as well. On achieving SDGs, if there is one thing we need to focus is, we're saying, on health promotion and disease prevention. That should be our focus, especially on social determinants, focusing on the root cause of the problems. I think the promotion and disease prevention should be central. And investment should be in primary health care. As you know, during this pandemic, even high-income countries were surprised because the investment in primary health care was very low. Many countries, high-income countries, were not even able to do contact tracing, which is the basics of public health, because their investment in primary health care was low. So investment in primary health care, most of the basic services, more than 80% actually provided at that level. But at the same time, investment in primary health care, because it's when the primary health care is strong, we can detect outbreaks early and address them quickly. So it's good if you invest in primary health care, it's good to provide services, but it's also important for pandemic preparedness and response. But when you say primary health care, that's why we said it can be also used for health promotion, and this prevention is done at primary health care level. The other maybe focus should be on digital technology, use of digital technology. Of course, there is a debate going on, but the access issues, the equity issues with use of technology can be addressed. So digital technology, if used properly, could address the access gaps or the equity gaps that we see. So these are probably what we say should be our priorities. Keep the SDGs as a goal, focus on health promotion and disease prevention, invest in primary health care to provide services, not only that, but for pandemic preparedness and response, and use technology as equalizer. Sometimes technology could even widen the divide, but we can use technology as to address the gaps between the haves and the have-nots.
So I'm going to raise also the question of financing the World Health Organization, because I don't think most people will know that most of your finance that you need is not guaranteed by governments. You've got to argue for it every few years. And so only 12% of your budget you can assume you're getting at the moment, although that will go up in the next few years. But the cost of the World Health Organization over 3 years is 11 billion. That's what you're asking for. And I work out that's only 30 pence per every person in the world. Only 30 pence a year. A very small amount to pay for the guarantee that you've got an organization delivering on global health. Now, in other areas like peacekeeping, the funds are guaranteed to the United Nations by governments. You are having to go out and argue the case to get this other 88% at the moment. How can we put the best case for countries like ours ensuring that you have more guaranteed resources for health?
Yeah, no, thank you. First of all, thank you so much for your support as our ambassador on health financing. I hope, as you rightly said, I can add to what you said. WHO's budget is, the annual budget is less than a middle-sized hospital in a high-income country, even less. So the investment, needed compared to the mandate that WHO, or the investment that's happening now, or the financing compared to the mandate WHO has is almost nothing. So that's why we have started this sustainable financing to address the challenges that you said, Gordon. For instance, the flexible funding we have, which we call assessed contribution from governments, is less than 20%, or around between 12 to 16% it can range. If you don't have flexible funding, if you don't have predictable funding, it means you're not empowered. It means it can affect the planning itself, because you cannot plan based on priorities. So when it comes to financing, it's not the amount of money, it's the quality of the funding. Because with the quality of the funding, with the flexibility, predictability, comes empowerment. So when we asked our member states to increase funding, not only the amount of money, we told them that will improve the quality, which is empowerment of the World Health Organization. If that happens, then we can support countries based on the priorities. I said earlier, SDGs. We can plan based on SDGs. Not only that, we can also give long-term contracts to our staff. So stable staff means the work environment could improve, and that means you can get result. And there is better signs now, because member states have agreed to increase assessed contribution by 50% in the next 7 years. This is, by the way, the highest in the history of the organization, because in the last 75 years, the increase in assessed contribution was only 3%. That's it. So there is agreement on that, but change will not come tomorrow. This is a commitment to happen over 7 years, but we believe it will happen because they have already decided during the assembly. Of course, we have other mechanisms as well. The immediate ones are broadening the donor base, and we have established the WHO Foundation, and one thing ongoing is the investment round. So it's increasing assessed contribution, broadening the donor base, the WHO Foundation and the investment round. Especially the assess contribution and the investment round will bring the quality money, which is the predictable and flexible, that can empower WHO. So that could help us to achieve or to do better. And I hope your advocacy is helping, and I hope member states will continue to honor their pledge. But the initiatives we have started in terms of financing are game changers for WHO. And in 7 to 8 years, by then actually I will be out, I think we will be in a better position. And this was one of the root cause of the many challenges we face in WHO, which is the financing, and it's being addressed. By the way, one thing I would like to share with you, when I was Minister of Health, Gordon has a real commitment to global health financing. When he was Prime Minister, he invited me to join in his committee, health financing, especially for the developing countries. And the compact we signed then with donors was a result of the advocacy that he did. And I remember, it's the same concept with WHO, by the way, helped us to get flexible funding in one pot. The actual movement at that time, or the initiative we started, was one plan, one budget, one report, and asking donors to pool their funding and not earmark it, make it flexible, so countries can use the funding based on their priorities. And the first compact we signed with that initiative he started with Prime Minister of Norway, I remember Stoltenberg, the NATO Secretary General now. The first pooled funding we got, around $180 million was unearmarked and came to the government treasury and used to invest it flexibly based on our priorities. And that's when we started to see change, actually, because we could use most of the funding where it was needed, like, for instance, to reduce maternal mortality and to reduce under 5 mortality. And most of the resources, more than 70%, went into maternal and child health. So it's the same concept now for WHO. If we get flexible funding, we can focus on priorities, helping countries based on their priorities, their needs, based on SDG goals, so we can make progress. We can deliver results, not based on donors' interest who give you earmarked funding, and you cannot operate based on.
So I was going to ask Dr. Tedros what he thought of all the world leaders he met, particularly since the first one you met when you became head of the WHO was President Trump. Is that right? And you had a very good relationship with him afterwards. But I'm going to pass over to Catherine now for questions from the audience.
No, thank you. In fact, we could listen to you both all night. I want to get an opportunity, though, for everyone in the room, not everyone, hopefully, some of you in the room, to ask a question. So if you raise your hands, then the nearest microphone, oh my goodness, here they come, here they come. This half is doing very well. Not that I'm going to make it a competition, but this half of the room is doing very well. I'm going to start right in the middle there. Thank you. Thank you.
Hi, sir. Thank you very much for the opportunity, and thank you for the work you do. I realize this might be a completely stupid question, but I want to understand, is the Accord an all or nothing deal? Obviously, unanimous buy-in is the ideal, but surely some buy-in is better than no buy-in. Does it have to be unanimous for this to pass, the negotiations?
You mean at the assembly level, it should get support from all countries. And that's, I think, what we expect. Then, of course, there will be ratification afterwards, and countries can either ratify or not. You know, signing the agreement initially doesn't automatically, they don't need to automatically commit to its full content. they can have time to think about it and then move into the ratification process, and they can ratify or not. So I don't think countries will have a problem to
Does the
agree.
assembly have to be unanimous for it to go through?
Yes,
Okay. And then
Yes.
after that, it's individual countries.
yes.
Okay. Thank you. Good question. It wasn't a stupid question at all. Excellent. Right. There's lots of hands. Go forth.
Hi. Thank you, Dr. Tedros. Joseph Zhao from School of Social and Political Science. So my question is more from as a leader of a multilateral organization, as well as trying to coordinating, maybe encountering a lot of ethical dilemmas as well as geopolitics. As a leader and a person, how do you uphold the values as well as trying to find the balance with all these kind of challenges? Thank you very much.
Yeah. Balance. If you try to balance, you may not be able to balance. Probably the balancer is if you follow the principles you should follow, and especially based on science. I will tell you some examples. As soon as I became Director General, I had a meeting on sexual reproductive health rights, including abortion, and I was advised by my colleagues that don't use that word abortion. Then I said, why? Because you will be accused of taking sides with countries who are pro-abortion. Then anyway, I said it. Although I was advised not to say it, I said it. Then like what my colleagues said, some member states were unhappy and they accused me of the same. Oh, Tedros is taking sides with countries who favor abortion. Then I told them, no, I'm not taking sides with this country or that country. Of course I'm taking sides, but not with countries. I'm taking sides with science and evidence. And based on science, I can say this. That's what I'm saying. And I also told them, if I take sides with any country, WHO actually could be in trouble, because take one country. When the left comes, for instance, the US, when the left comes, their abortion and sexual reproductive health rights, no problem. When the right comes, if the government is from the right, then there is complete ban. So even one country can shift from one position to the other. If you take a position with one country, what will happen? Then you will act like a pendulum. So the key is to really take the right position based on science and evidence, and a principled one. We had issues, some countries had issues with us because of the positions we took. For instance, on what I said, the example, there are some people who like it or some who don't. Or even in the same country, there are some who like it and some may not, but if you follow science, it will be okay. At least you can answer any questions they have or address the issues, and you can say it without any problem because you're following science and evidence. Then another example is with the war on, the invasion of Ukraine. And I submitted a report to the board that angered Russia. And they were upset. And I said, this is my report, and I take full responsibility. So if you have any issues, tell us, we can correct. But general attacks, we told them wouldn't actually help. But I stood by that report because the report was truthful and principled. So instead of trying to balance, what we do is our report truthful, and are we following principles, the right principles? And then can we really answer the questions that may come because of this report? If you're confident on that, then that's it. So although there was a serious problem during a board meeting and even unnecessary attacks on me because of the report that was coming from Russia, we uphold our principle. I can give you many examples. Then even now on Gaza and Israel, we don't take sides. We asked from the start, we condemned the October 7, we asked for the release of hostages, but at the same time, what Israel did is not justifiable. And we asked for a ceasefire, and all the reporting from what we saw in Gaza was very principled and truthful and the right one. So I think following the principles, being truthful keeps the balance. You don't need to try to keep balance. That's when you will do something wrong. So the balancing comes from being truthful. Some may be unhappy, then it's fine, because you can't make both two opposing sides happy. So it's better to take the truthful side. I can give you many examples that cause some tension. These are the 3 examples I gave you with the US, for instance, during the pandemic with the previous administration, with President Trump, and other examples. But we face the consequences by telling the truth and saying what has to be said, and then we face the consequences.
Thank
So
you.
no need to
No,
balance.
I'm just going to tell the truth that we're running out of time fast.
Okay.
So we're going to get some quick fire. Oh, look at all these hands still. Oh my goodness. I'm going to come to over here because, excellent. Great questions. We're going to have to quick fire answers.
Thank you very much. And may I please just give thanks or a round of applause to everyone, the team of University of Glasgow, for giving us this awesome opportunity. I am from Lesotho, and for those who do not know, it's a very small country in Africa. So at least I have Dr. Tedros who can relate to what I'm about to say. And congratulations to you, Doctor. We're really grateful. My question is, what is that one advice or advices that you would love to give to young people who would like to go into your footsteps, but of course, who would like to maybe do way higher than what you're doing? I am more passionate about inclusive education, and I'm very much glad to be at this university. So I want to see myself where you are right now, not just on that chair, but with all the good leadership skills. Like, you are one of the people who really do good work, but I want to do good work in the education sector. I've already started, but I want to do more. So what are those kind of advices that you would love to give? Thank you very much.
Great question. Thank you. What advice would you give to young people who want to follow in your footsteps and then do more?
To be honest, I may not give a good advice on this because I ended up here without maybe planning to be here. You put me anywhere and give me a job, I give it my best. Then, to be honest, I don't know even where I would go after that. I believe in planning, but I didn't plan to be here. Actually, when I was a child, I was trapped in the middle of a war. That's why I always advocate for peace. And my mother's prayer was, God, please help me or help my son survive a day. Just one day at a time. People who have been in that situation, maybe to be in where I am now, it could be a miracle. But I didn't plan or even wish to be a minister. I was a minister and then a director general, probably. I don't know what happened, to be honest. But I know one thing is always helpful. Hard work and follow your heart. So I would say whatever you would like to have, I think if you can follow your heart, but at the same time, hard work can, if not take you wherever you want, but always takes you to a good place. Hard work can take you to a place, a good place. So that's what I think. I wouldn't complain about being here or there, as long as I can be somewhere where I can contribute and deliver.
I like that. Hard work and follow your heart. Thank you. We have time for one more. Oh my goodness. I feel I need to go to this side, I'm afraid, only because I've only done one from this side. Oh, you're running. Look at that. Thank you.
Thank you for the opportunity. I currently work here for the Living Lab for Precision Medicine, but during the time of the pandemic, I was in India and I was working on the ground level for COVID-19 patients. So throughout my career, I have been working for patients only on sickle cell anemia, which is a rare disease, and still to the world it's not really important, but to countries like Nigeria, India, it's really important. And there was this situation where we had an oxygen crisis and we couldn't treat our patients. So reflecting back on that, when I think about the future steps that we are taking for the pandemic, what according to you we should do for the rare diseases, for the people with rare diseases when we are dealing with the pandemic? Like, because we are discussing about equality, equity, can we also consider this point where we are considering the economic aspects, but also about the people who are suffering from the rare diseases? I would like to hear your opinion on that.
Thank you.
Yeah, no, that's true, especially people affected by rare diseases, because it's not a problem for many, could be forgotten. And when you say no one should be left behind, means no one. And there are initiatives actually by countries, initiatives to address those. And what we're doing is collecting those best practices and sharing it with countries and helping them to address especially people affected by rare diseases. So if you're interested, we can give you some of the initiatives that we have, best practices from countries to cover those, and you can have a look. Yeah. Thank you.
Thank you. I just want to make a massive apology because I feel we actually need to get Gordon and Dr. Tedros back for a day and just have a day-long conversation, because there's obviously so many questions we just haven't managed to get to today, so apologies for that. Thank you for your interest and support and your time this evening. Thank you to you both. It's been a fascinating conversation. I feel bad having to cut it slightly short, but I know we could listen to you for many more hours. But thank you for the conversation tonight, but also thank you both for the incredible work you do. It is so important, and you do such an incredible job, both of you, and you do it with such passion. So we are very lucky to have you both here tonight. And I would just like to ask the Principal to come up on stage to join us for the final words tonight.
Well, Chancellor, thank you very much for hosting that fireside chat. Can I add my thanks to our two speakers this evening? As you mentioned, Chancellor, we have the good fortune of having two honorary graduates of the University on stage, and it's a great pleasure to have them both. Dr. Tedros, thank you for coming and taking time out of your busy schedule. Thank you for bringing your family as well. I hope you're enjoying your first visit to Glasgow. But I think, as I said, it's a real honor for us at the university to have two global visionaries here this evening, because Gordon, your insights as a former Prime Minister who's played a leading role in managing the great global financial crisis in 2008, and who now uses his experience to represent the WHO as an ambassador for global health financing, is important. And I thought the exchange between you around the financing of the WHO is just so important. It is a critical issue, I think, for the world to deal with. Dr. Tedros, thank you for your sage remarks about the value of partnerships across the globe and the real responsibility that we have to stand up and address the greatest health challenges facing our planet. This evening, thank you for honoring us and accepting an honorary degree. You join a community of world changers throughout the centuries, and you mentioned a number of them in your remarks, and we're really grateful for that. Also particularly grateful that you mentioned our alumna, Dima Al-Hajj, who was working for the WHO, who was killed in Gaza. And I think it just shows the work that the WHO does on the front line, bringing communities together. You said it very clearly, we are one humanity. And this is what we can do, the only thing we can do as university, to remind ourselves that we are one humanity and we have to strive for peace. Thank you both for your comments on the need for nations to step up and sign a global pandemic accord and ensure that we learn the lessons of COVID-19. I want to thank my colleagues here in Glasgow in various ways in which they acted during that time. Our Medical Research Council, University of Glasgow Centre for Virus Research, did a huge amount to sequencing the variants and monitoring the variants of COVID throughout the pandemic. But here also we had a really incredible example of volunteering where hundreds of our colleagues here in the university, virtually overnight in April 2020, dropped their tools in their life sciences labs and created the Glasgow Lighthouse Lab at the Queen Elizabeth University Hospital. And I have to pay tribute to my colleague, Professor Dejana Dominicek, who's in the front row. This was Scotland's only mass testing facilities that processed 31 million cumulative tests throughout the pandemic, and the only UK Lighthouse Lab that was run from a university. So thank you to our colleagues. And thank you, Dr. Tedros, for mentioning our students who have committed themselves to being the University of Glasgow's support for the Pandemic Accord, and we will certainly support them in that endeavour. Now, I'm an economist, and what I do understand is that health and economic impacts of the pandemic have to be understood as a system. And with climate change, as you mentioned, affecting our planet and zoonotic diseases likely to increase, we have to deal with this as a system, the global health system. And this takes me to the World Health Organization. Before this evening, I sought to remind myself of your mission as a WHO, and that is to promote and improve health, protect from health emergencies, and serve the vulnerable. And as my colleague Ian McInnes mentioned in his oration for Dr. Tedros, that's in a sense why we were created. We are a medieval university. We were founded in 1451, but as Ian said, part of our edict around our creation was talked about raising to distinction those that were born in the lowest place and helping those with the fountain of science. And that's about creating social benefit locally whilst addressing inequality and injustice. And that's the mission of our institution. And this is something which we've tried to translate onto the stage. I was delighted to hear you mention the UN Sustainable Development Goals. They're a key part of our strategy. There is an attempt to evaluate how universities do on the UN SDGs. The Times Higher Education produces an annual ranking, and we were actually 13th in the world. And we strive to make this a much more central plank of what we're doing in future. And again, we heard this evening from both of you about the need for global cooperation and global leadership, because we understand that it's not only about tackling health issues, but unless you look at the whole arc of the UN Sustainable Development Goals, we will not be able to tackle these issues. Now, again, Dr. Tedros, I don't want to repeat everything that my colleague Ian McInnes said, but you exemplify what global leadership means. It's about harnessing collective expertise. It's about enthusiasm to empower communities to drive positive change. It's about trusting in excellent science, as you said at the very end, challenging the status quo and empowering intergenerational action. And as universities, being civically minded means taking a step back to look at the wider challenges facing our global community. We're very proud of our international partnerships. This is not something any university can do alone. We were talking earlier in a meeting about the work that we're doing as part of the Guild of European Research-Intensive Universities, working with the African Union and the European Union around some of our clusters of research excellence, looking at how we can tackle non-communicable diseases, looking at how we can tackle food security and many other issues. And that is something I certainly want to commit, again, the University of Glasgow to doing over the years ahead. We are one of the best universities in the world, but as we like to say, we want to be one of the best universities for the world, and that is what matters much more to us. So each of my colleagues and all of our students here this evening are, I'm sure, hugely inspired by what they've heard from our speakers. All I want to do is just to thank you both for joining us this evening, and thank you, Chancellor, for chairing the discussion and stewarding tonight's procedures. Thank you to all my Glasgow colleagues who've been involved in organising this evening, and to Dr. Tedros' and Gordon's offices for supporting this event. And finally, thank you for coming along and making this such a wonderful evening. And as Catherine said, we have to do this again sometime. Thank you all.